All right. Good morning or good afternoon. It is 1:02. I'd like to call this roundtable to order. Today is Tuesday, September 23rd, 2025. We are in room 500 of the John A. Wilson Building, as well as on the Zoom internet platform for a hybrid meeting. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we will hear from two nominees to health-related boards in the district. We'll begin with a nominee for the Health Benefit Exchange Authority Executive Board, and then we'll turn to the nominee for the Board of Dietetics and Nutrition. I don't see any of my colleagues who have joined us, but if they do, we'll certainly turn to them. So before we get started with the actual nominees, we actually do have one public witness who signed up to present testimony today. He's here in person. So Mr. Branham, when you're ready. And you'll have 3 minutes.
Greetings and salutations, Madam Chair and members of the committee. I am Robert Vincent Branham, Chairman of the Ward 5 Leadership Council Public Safety Committee and President Emeritus of the DC Federation of Civic Associations. I come before the committee and the people of the District of Columbia to testify that I remember. I remember the life in the district during the devastating period of the COVID-19 pandemic. I remember how anxious and fearful Americans and my fellow Washingtonians were during the height of the COVID-19 epidemic. I remember my beautiful goddaughter, Shanae Marie Taylor, taken from me and her family, falling victim to COVID-19 on September 30th, 2020. I remember holding her hand and kissing her on her forehead one last time. I remember whispering in her ear and saying, "I love you," one last time. I remember Department of Employment Services Dr. Unique Morris Hughes presenting me a mayoral's remembrance letter and reading it at her funeral. I remember, Madam Chair, I also remember the leadership of Dr. LaQuandra Nesbitt. I remember Dr. Nesbitt coming to work early and leaving late. I remember Dr. Nesbitt standing before the cameras to offer sound and honest health advice to the people of the District of Columbia in the face of city, national, and world uncertainty. I remember Dr. Nesbitt's almost daily standing tall, firm, and resolute, comforting the people of the District of Columbia, saying, "This too shall pass." All this I remember, and I shall never forget. Madam Chair, members of the committee, I remember how Dr. Nesbitt led us through the COVID-19 storm and guided us toward calmer seas. I come to support this nomination without hesitation or reservation. I strongly support the nomination of Dr. LaQuandra Nesbitt in the loving memory of Shanae Marie Taylor. Thank you.
Thank you, Mr. Branham. And I'm very sorry for your loss. But thank you for being here today for the testimony that you provided.
Thank you.
Thank you. Okay, so we're gonna move on to the nominees. Um, and okay, Mr. Trost, in an effort to not have you sit at the table this entire time, um, we're gonna do Dr. Nesbitt first. So I'm going to say a little bit about the Health Benefit Exchange Authority Executive Board. So PR 26-240 nominates Dr. LaQuandra Nesbitt to the Health Benefit Exchange Authority Executive Board as a voting member, filling a vacant seat formerly held by Ramon Richards. And this is for a term to end on July 6, 2028. The Executive Board governs the Health Benefit Exchange Authority, which oversees the district's insurance exchange under the Affordable Care Act to expand consumer choice and affordability in health plans. The board is composed of 7 voting members who are district residents appointed by the mayor for a 4-year term and 4 non-voting ex officio members. Voting members must demonstrate expertise in at least 2 areas, such as healthcare coverage, plan administration, finance, delivery systems, insurance management, actuarial analysis, healthcare economics, human services, consumer advocacy, public health programs, or enrollment into health plans. Believe Dr. Nesbitt probably fits most of these boxes, but a little bit about her. Dr. Nesbitt is a board-certified family physician with extensive experience in population health leadership. She served as the director of DC Health from 2015 to 2022, where she oversaw major public health initiatives for 4 years before leading the district's COVID-19 response. She also served as the interim director of the Department of Behavioral Health. In this capacity, she serves as an ex officio member, or in her previous capacity, she served as an ex officio member for the HBX board, given her direct experience into the governance and operations. Prior to her service in the district, she directed the Louisville Metro Department of Public Health and Wellness, where she led initiatives focused on implementation of the ACA, as well as violence prevention. She's currently a senior associate dean for population health sciences and health equity, and the bicentennial endowed professor of medicine and health sciences. Whoo, chow. Okay. At the George Washington University. Yeah, I hope you do say that every time they introduce you, Dr. Nesbitt. She also directs the Center for Populations, Health Sciences, and Health Equity. She has served on the advisory bodies for the CDC as well as the Commonwealth Fund. She earned her MPH from Harvard and her MD from Wayne State University, and she is a Ward 4 resident. Dr. Nesbitt, when you're ready.
Thank you, Chairperson Henderson. And I have prepared remarks, but they seem inadequate to express my interest in coming back to serve the district in an official capacity after my dear friend, Mr. Branham, came down and spoke in support of me, highlighting and articulating what is a steadfast and ongoing commitment to district residents that I will always have. So I will read my prepared remarks, Chairman Henderson and members of the committee. As was stated, I am Dr. LaQuandra Nesbitt, and it is my pleasure to receive your consideration for my nomination to serve on the Health Benefit Exchange Authority Executive Board. I am grateful to Mayor Muriel Bowser for nominating me and honored to have this opportunity to again serve the residents of our district. I am deeply committed to advancing equitable, accessible, and high-quality health care for all district residents. I submit my statement of interest for appointment to the DC Health Benefit Exchange Executive Board, building upon my more than 2 decades of leadership across public health, population health equity, and health system innovation. Throughout my career, I have held several leadership roles in public health in the District of Columbia and beyond. Notably, I served as director of the DC Department of Health from January 2015 to August 2022, where I spearheaded strategic initiatives to address health disparities across the district. I also held leadership roles in public health in both DC and Kentucky, including directing Louisville Metro's Department of Public Health and Wellness from 2011 to 2015, and serving as senior deputy director at DC Health from 2008 to 2011. I'm a nationally recognized expert in population health and health equity. Throughout my professional career, I have maintained academic appointments at several universities and currently serve as Senior Associate Dean and Executive Director of the Center for Population Health Sciences and Health Equity at the George Washington University School of Medicine and Health Sciences, where I lead efforts in population health and health equity, driving educational programs, research, and policies that reduce disparities. I have co-authored key publications like Population Health Management Policy and Technology, and scholarly articles addressing trust restoration in public health and strategies for improving population health equity outcomes. Furthermore, I have experience in board governance and advisory roles in DC as well as national organizations. Over the past 20 years, I have chaired or served on multiple boards and initiatives, including the DC Health Information Exchange Policy Board, the DC Health Benefit Exchange Authority Executive Board, DC State Health Innovation Model Advisory Committee to the Director of the U.S. Centers for Disease Control and Prevention, and the Alturum Board of Trustees. Experiences that sharpened my understanding of policy development, stakeholder engagement, and cross-agency coordination. The DC Health Benefit Exchange Executive Board ensures transparency, equity, and consumer-focused operations of DC Health Link, the district's Affordable Care Act marketplace. Notably, the board has championed equity-driven reforms, such as eliminating cost sharing for chronic and high-burden health conditions disproportionately impacting communities of color, including type 2 diabetes, mental health, and cardiovascular disease. So how can I contribute? First, I can help to advance health equity. Drawing on my leadership experience in health equity, I will help to ensure the design and evaluation of plan benefits that remove financial and systemic barriers for Black, Latinx, and underserved communities, aligning closely with recent board initiatives on eliminating cost sharing for high-impact chronic conditions. Second, I can ensure stakeholder engagement and trust. My background in developing advisory boards and partnerships ensures inclusive, transparent decision-making with consumers, providers, community organizations, and government agencies. And third, I can promote innovation and operational excellence. Combining academic and public health administration experience, I bring a proven ability to translate evidence-based strategies into equitable health systems and policy improvements, supporting the board's oversight functions. It would be my privilege to serve alongside the dedicated leadership of the DC Health Benefit Exchange Authority, helping advance DC's status as a national model for health equity and coverage. I welcome the opportunity to contribute vision, experience, and strategic leadership in pursuit of DC Health Link's mission, ensuring affordable, quality health coverage for all district residents. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and members of the committee.
Thank you, Dr. Nesbitt. And thank you for your willingness to serve again after leaving us or public service for a little bit. I want to first start with, so you've previously served on the Health Benefit Exchange Authority Executive Board, but as an ex officio member when you were leading DC Health. And obviously those were at different time periods, you know, when ACA was sort of in the infancy of rolling out and then where we are now. How will your approach differ now that you are, one, a voting member, but two, have a different level of experience with the system?
Sure. You know, first I'll say that we're at a different inflection point in terms of where our country stands in terms of nationally, in terms of some of the challenges that we're facing in keeping people insured, which was part of my interest in returning to the board and ensuring that we have all of the tools in our toolkit to ensure coverage of our population. As you know, I think we share a commitment to ensuring a high rate of coverage, recognizing that insurance alone doesn't keep people healthy, but it's definitely one of the main keys. We need to open that door to making sure that people have access when they need it. And so as part of my level of expertise that I can bring to the board now in a newer approach is ensuring that we are doing all that we can in terms of education and outreach efforts to make sure that all of the businesses, the small businesses know what resources are available for them to be able to help their workers become insured, making sure that everyone who may no longer qualify for public insurance understands what resources are available for them through DC Health Link. And again, that we are listening to stakeholders and we are partnering with the right organizations to do the education and outreach, especially in our communities where people may not be always aware of all of their opportunities for gaining access to coverage.
Ooh, thank you. So you'll be coming back on to the HBX board in the midst of the agency standing up an ambitious new health plan, the Healthy DC Plan,
Mhm.
which will cover an estimated 25,000 individuals who will no longer be eligible for Medicaid coverage starting in January. This is a significant increase in the number of residents who will receive their insurance through HBX. What ideas are you planning to bring to the board to shape a healthy rollout of Healthy DC, but also ensure its successful implementation?
Sure. There are times where we rely on typical outreach and education strategies to get to people who may no longer be in a coverage pool. And it's been my experience through some other activities that we have to think outside of the box in terms of being very innovative in how we reach people to make them aware of this new plan opportunity. First, in terms of their eligibility for the plan, and second, in terms of what the plan covers that may differ from other coverage that they may have had in the Medicaid program. We did something similar to this during the Affordable Care Act initial rollout in Louisville, Kentucky, recognizing that giving people an insurance card wasn't just going to be sufficient, but making sure that people understood their plan benefits and their benefit designs. And this was more than trying to reach 25,000 people. But you have to do this through health literacy campaigns. And when I say health literacy campaigns, recognizing that health literacy includes health insurance literacy, but also health systems literacy. And so I will be very interested or taking on a very serious role in making sure that these education and outreach campaigns include these components of health literacy that are around health insurance literacy, but then also health systems literacy, so people understand how to use these benefits in terms of accessing the right care in the right time in the right place. And that's where the experience with interagency coordination becomes extremely important, extending beyond, coordination with the Department of Insurance, Securities and Banking and the Department of Healthcare Finance, but also ensuring the right kind of coordination with the Department of Health and community-based organizations extending beyond the federally qualified health centers.
Okay. You're covering a lot of the questions that we have here in your responses. Let me ask some more sort of administrative ones, kind of brass tacks. So your CV, you list on numerous advisory and trustee positions, including with the GW Medical Faculty Associates as well as Altrum. Do you foresee any potential conflicts of interest, and how will you manage them?
Yes, so Alterum is not a DC-based entity, nor does it deliver healthcare services or a contract for healthcare services or insurance. So I don't perceive any conflicts there. Having served on boards that do have the potential for conflicts with entities that it may do business with, I am familiar with the need to disclose conflicts of interest on an annual basis, financial or otherwise. So I would be prepared to do that if those would arise with this position on the Health Benefit Exchange Authority Executive Board. in my role with the university. As you know, there are other academic members of the board. The second piece with the being a member of the board of trustees of the medical faculty associates, I don't foresee any particular conflicts of interest arising there. I would say that that gives me some insight and awareness into, again, the downstream impacts of what having a highly uninsured population in the District of Columbia does in our healthcare delivery system, and making sure that that helps us inform what our plan designs need to be, et cetera, but more from a holistic perspective and nothing to the benefit of one particular organization or not.
Okay. You hold significant leadership roles at GW, Executive Director of Research Center, Associate Dean, et cetera. I'm sure that the staff has explained to you some of the time commitments that would be associated with serving on this board. Do you feel that you're able to manage it all?
Yes, I have been very diligent in terms of managing time commitments post my role in executive leadership in the government of the District of Columbia, such that I am only committing to things for which I can serve at full capacity. So I am aware and abreast of the time commitment to service on this board. And I'm only here today in front of you because I am able to manage those time commitments.
Great. Is there anything I haven't asked you that you want to mention today?
Well, you know, I think that this is I know that this is a critical time for all of us who work in the health space. I'm, you know, honored to have the opportunity for consideration to serve on this board, and recognize that we all have considerable opportunities before us to ensure that the district maintains its high rate of coverage, including for many of our populations who don't have the highest incomes, who live in some of our more geographic neighborhoods that have been under-resourced. And, you know, I just want to ensure that we continue to have a health benefit exchange that brings focus to those communities, as well as the other responsibilities that they have. So thank you again for your consideration, for the council's consideration.
All right. Thank you so much. Thank you, Dr. Nesbitt. I don't have any further questions for you. I think we have all the materials that we need, but if we should need anything additional, we'll certainly reach out.
Thank you.
Thank you. All right. We'll now turn to the Board of Dietetics and Nutrition. The Board of Dietetics and Nutrition regulates the practice of dietetics and nutrition in the District of Columbia. This board is comprised of 5 members appointed by the mayor. Of the members of the board, 4 shall be licensed dietitians or licensed nutritionists, and 1 is a consumer member who is not licensed. PR 26-276 nominates John Trost to the Board of Dietetics and Nutrition as a consumer member, filling a vacant seat formerly held by Chelsea Richardson for the remainder of the term ending on March 12, 2026. Mr. Trost is a recent graduate of Hamilton College with a bachelor's in history and a minor in government. He currently serves as a democracy program assistant with the Weiss Foundation. He also served as a student trustee at Hamilton College Buildings, Grounds, and Equipment Committee, and has been active in the historic preservation work through the Carlisle Historical Society. Mr. Trost is a Ward 2 resident. Mr. Trost, welcome.
Good afternoon. Good afternoon, Chairwoman Henderson and members of the committee. I'm John Trost, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Dietetics and Nutrition. I am grateful to Mayor Muriel Bowser for nominating me and honored to have the opportunity to serve the residents of the District of Columbia in this capacity. I am a relatively new resident of the district. I had a wonderful opportunity to study in Washington, D.C. during college and serve as a congressional intern. I knew right away that I wanted to be a permanent part of the DC community after graduation. I currently work in the nonprofit sector, serving as a program assistant for a DC-based private charitable foundation that supports lasting solutions that empower communities, improve lives, and strengthen connections to the land. I have always valued public service and social impact, which is why I look forward to representing the citizens' perspective on the district's Board of Dietetics and Nutrition, if confirmed. My first job growing up was working on a small organic family farm in Massachusetts. Like most young people, I didn't really understand our nation's food system. This experience over several summers made me appreciate the hard work our farmers do each and every day to grow the produce we all depend on. It also sparked my interest in sustainable agriculture, nutrition, and healthy living. I had a chance to pursue this interest further in college, where I considered minoring in environmental studies. In my current job, I help oversee over $1 million in annual grants to food pantries and community programs that provide meals to those in need and assist with the foundation's communications efforts to promote the important work of these grantees. The Board of Dietetics and Nutrition plays a vital role in licensing the most qualified and capable nutritionists and dietitians. While having a board composed of professionals in this field is important, it is also crucial for the public perspective to be represented. I look forward to serving in this important capacity, conducting a thorough review of each prospective licensee and engaging in oversight over current license holders. If confirmed, I also hope to use this position to raise public questions or concerns about matters related to nutrition and those practicing in this field to ensure that all community stakeholder input is heard. I believe my interest and background will make me a good addition to the commission and make it more representative. Thank you for your consideration of my nomination, and I welcome any questions you may have.
Thank you, Mr. Trost. Let me first start asking, how did you become interested in serving on this board?
Yes, so as I mentioned, I've always valued public service and social impact, and I am really interested in getting more involved in DC local government. And as I mentioned in my testimony, nutrition has been an interest of mine, so I'm looking forward to pursuing that.
Okay.
Hopefully.
But you're being nominated as a consumer member, which for other boards, it's usually someone who has received those services, et cetera. Can you say a little bit more about how your experience prepares you to represent the consumer interest on this board?
Of course, yeah. So I obviously have worked with organizations that provide services such as meals, food pantries. And I think my experience also working on small farm back in Massachusetts is also relevant. One of the farmers who actually ran the farm was a licensed nutritionist. So I did get some exposure that way as well. So yeah.
Okay. Are there any specific consumer concerns in nutrition or dietetics you believe are most pressing for DC residents today? And how do you, plan to bring those concerns to the board's attention?
Yeah, so I would say I am a big believer, as I mentioned in my testimony, in making sure that all stakeholder input is considered. And that is going to be a priority of mine to make sure that we evaluate and consider all public comment. One of my experiences working on the Hill was doing constituent services. So I got a lot of exposure to working with the public and making sure that public comments and concerns made their way to the Congresswoman and members of her staff. So I am definitely going to ensure that any concerns are raised with the committee. And in terms of, pressing issues related to nutrition, I think the most important role of this board is making sure that the most qualified and capable people are licensed. So I look forward to giving very careful consideration to all applicants' background and also conducting oversight over current license holders.
Okay, so the makeup of the board, there are 5 members of the board, 4 of which are licensed, either nutrition or nutritionists or dietitians. How do you see yourself in sort of, I don't know, as someone who's neither licensed in either of those areas? Do you believe you will be comfortable enough to push back or to make sure that the consumer voice is heard?
I definitely think so. And, I'm a big believer in, I think every board should have some public representation. I think it helps balance professional interests. It enhances public trust, and public members can offer, a unique perspective and a different range of skills and experiences. And I look forward to sharing that with the board.
Okay. And it's sort of a administrative question. I think have you talked to the DC Health about the time commitment for this particular board, and do you feel confident that you'll be able to serve?
Yeah, so I don't think I will have any issue attending the regular quarterly meetings. I've reviewed some past agendas for the board, and I don't think that the time commitment will present any issue.
Okay. Just curious, not that this matters, but I always do these PSAs. Did you just go to the Moto website to apply, or were you recruited for this position?
I applied, yes.
Okay, so it does work. All right, so that is my segue to give a PSA. We have lots of boards and commissions and an opportunity to serve your community in that way. And so if folks could go to the Mayor's Office of Talent and Appointments website and see what's open and available and where your interests might align. Okay, do you have any other, anything you want to add that I haven't asked you today?
No, I would just say, again, I'm very grateful for the mayor's office for nominating me, and really appreciate your consideration and the council's consideration, and look forward to hopefully serving in this capacity.
Great. All right. Well, thank you so much, Mr. Trost. I want to thank you as well as Dr. Nesbitt for your willingness to serve on these boards as representatives of the district. The Committee on Health will hold its next meeting on Thursday. We will consider and vote on both nominations that are before us today. That concludes today's roundtable. The time is 1:35 p.m. and we are adjourned. Thank you.